My patient was an 11-year-old female. Her body weight was appropriate for her height and her weight. Her body fat was distributed evenly throughout. Um, Her posture was erect and relaxed. The speech was clear and understandable. The patient spoke in fluent English. Her mood was appropriate for the conversation. Her gait was steady upon ambulation. No deformities were noted, and the patient did not state that she was experiencing any pain. The patient was well groomed. Her skin color was normal for her skin tone. She did not have any tattoos. The patient did have bilateral earlobe piercings. There was no skin tinting present. Good skin turgor was noted. She had full range of motion in all extremities with no muscle weakness. Her hands and nails were clean, well kept and clipped, with no debris noted underneath the nails. Cap refill was less than 3 seconds in all extremities bilaterally. Her hair was coarse and thick. No lesions or dandruff were present on the scalp. The patient did not express that she was experiencing any pain or tenderness upon inspection. Her head was normocephalic. The nose was midline. No discharge was noted. There was not any redness present or any lesions. Her nostrils were symmetrical and even. Cranial nerve 1 was present. The temporal artery is present with no limitations. No pain on palpation of frontal or maxillofacial sinuses. Her carotid arteries were present. No bruits were noted. No pain or tenderness was noted. Lymph nodes were symmetrical bilaterally. No swelling or tenderness was present. Trachea was midline and symmetrical. The thyroid is symmetrical with no pain or lumps. The eyes did not have any discharge. Eyelashes were distributed evenly. Conjunctivae were pink and moist. The sclera was white with no yellow present. The corneas were clear with no cloudiness. The iris was flat and round with evenly distributed color. The field of gaze, cranial nerves 3, 4, and 6 were present. Lips were pink with no cracks or lesions. The buccal mucosa was pink and moist with no lesions or sores. The teeth were white with no debris or decay present. Cranial nerve 12 was intact. The tongue was pink with ridges. Her hard palate was white with transverse rugae. The soft palate is pink. Cranial nerves 9 and 10 were present. The uvula rose midline. Ears are even bilaterally with no pain or tenderness present. Posterior lung and thorax were palpated and auscultated. Lungs are clear bilaterally in all lung fields with no adventitious breath sounds. No pain on palpation. No CVA tenderness was noted. Anterior chest palpated and auscultated. No pain on palpation. Lung sounds were clear bilaterally in all lung fields with no adventitious breath sounds. S1 and S2 sounds were present. No S3 or S4 was auscultated. Apical pulse palpated in the 5th intercostal space midclavicular line. The abdomen was flat and the umbilicus was central. No lesions or pain were noted. No discharge was present. Active bowel sounds present in all 4 quadrants. No high-pitched gurgling noises. No pain or tenderness on palpation. Tympany in all 4 quadrants on percussion. Legs are symmetrical. Skin color is appropriate for skin tone. Hair distributed evenly on the legs. Full range of motion bilaterally. No limitations. The full range of motion in hips, knees, ankles, and feet. There was no pain or discomfort present in the extremities. I palpated her femoral, popliteal, posterior tibial, and dorsalis pedis pulses. They were all strong and equal bilaterally. Cerebellar function was tested and it was normal. Patellar reflexes tested and showed no abnormalities. Scoliosis screen showed no abnormalities. Spine was straight. No rib bulges or hip displacement was present. And that was the conclusion to my head to toe assessment.